Hello YouTube, this is Mark Hill, the Traveling NP. Weather's kind of bad today outside, and decided while I was kind of cooped up, I'd make a video that I've been thinking about for a while. And this video is specifically geared to nurse practitioners or PAs, I guess, that are having trouble or at least considering going into locums. And a lot of them are finding themselves come up against a lot of roadblocks when it comes to finding jobs. And there are several things that you need to consider and things that you need to do when you're getting into locums, and there are some obstacles that you will have to overcome. First and foremost, as a new locums, you've got to remember that in locums, credentialing, especially for hospital work, can take a long time. You're going to wait at least 6 weeks, and in often cases, you're going to wait 2 to 3 months to get your credentialing done. Now, that won't be the case necessarily for family practice assignments or urgent care assignments. Sometimes they can be done a lot quicker, even as short as 30 days. That's the shortest I've had a credentialing done, was 30 days. And then after that, I think the next shortest was like 6 weeks. But one of the key components in getting your credentialing done is making sure you hurry and very effectively get all of your paperwork in. Now look, filling out this application, getting all your paperwork in and getting all your credentialing stuff in is a pain. It is a royal pain. It's a lot to do. It's a lot to fill out. It's a lot to sign. But when you get several staffing companies lined up and you get all that paperwork done, then it becomes a lot easier. One criticism that I've heard from numerous staffing companies and recruiters and contract managers is that locums providers are for the most part, are very lackadaisical when it comes to getting all their paperwork in, to getting all their licensing paperwork in, to getting all their credentialing paperwork back to the staffing company. It just takes days and sometimes weeks. And then they wonder why all the credentialing stuff doesn't go through any faster than it does. So getting your paperwork in, getting the requested stuff in is very, very important. I can tell you, after having done this for a while, I have all of my credentialing paperwork uploaded on my computer. And so when I get asked for credentialing, licensing, certifications, all that stuff, all I pretty much have to do is go onto my computer under my file name and point, click, and press send on the emails. Now, a lot of your licensing stuff and contract stuff is going to have to be done by FedEx because they want original signatures. For some staffing companies. Some staffing companies don't seem to care as much. Others do care. So it just depends on the staffing companies and on the hospitals that you're getting credentialed with. Some big hospital organizations are a pain to get credentials with, like Sanford Health Systems out of Colorado. I've been trying to get credentialed with them for a little ER gig in Bagley, Minnesota now for about 3 months. And they told me right out of the gate that it was going to take at least 90 days and probably 120 days to finish the credentialing for them. So I started this back at the end of July, and it's rocking on now. We're almost to December, and I still haven't finished all my credentialing. Now, according to them, I've got all my information in. They're just reviewing everything now. So we'll see. I may have done all that work for nothing. Sometimes they decide that you're not what they're looking for, and they won't credential you. So you never know for sure, because any little thing can throw a wrench in the works. So get your paperwork in, get your paperwork organized, get all your licenses organized, get to where you have it all uploaded on your computer to where you can just point and click. Because the faster you get that stuff in, the faster you're going to get an assignment. And also, the faster you're working and more eager you are to get all your stuff in, the more eager your recruiter is going to be. So a lot of it has to do with, your personal motivation to get things in. One thing that I've heard from several people who have contacted me in the last couple weeks is that they seem to be having problems getting started. And I try to give out a lot of information to people who are trying to get started, to recruiters that I've used in the past and the companies and things like that. And I've referred a lot of people to recruiters. There's a couple of things that new locums people need to take into consideration. And one of these I've broached in the past, and that is specialization. Other than psychiatric, and even psychiatric in some cases, the more specialized you are in locum tenens, the harder it's going to be to find placement initially. The more generalized you are, the more family practice oriented you are, the more urgent care oriented you are, and the more ER oriented you are, the more likely you're going to find your initial placements. If all you've done is acute care nurse practitioner in a hospital setting, say in an ICU, that's a hard placement to find for locums. There's just not a huge need for it. If you're just peds certified, you're a peds nurse practitioner, it's hard to find just peds clinic. There are some out there, but it's hard to find them. Geriatrics, difficult. Acute care, if you can only see patients of 16 years of age and older, most clinics, most urgent cares, and most ERs don't want you. Now, some of these acute care practitioners go back and get a peds rotation, which helps, but generalist is the key. Generalization, being able to see all ages from cradle to the grave is the best way to get a job. So the more specialized you are, you just have to know going in, the harder it's going to be. Which leads me to the second point. Your first assignment is always the hardest assignment. And sometimes you have to take what you can get. Sometimes you're going to have to take low ball offers. I know I did. I took just crap assignments, whatever I could get, and got my foot in the door, knowing that it was what I had to do to get my foot in the door. After you get a couple of months under your belt as a locums, and you get a good reference from the people that you're working with, and they can honestly tell the recruiter that you're good to work with, you're a good clinician, you're easy to work with, people get along with you. All those things are important. When you get that reputation, look, your first assignment, I can tell you from experience, after your first assignment, and you finish out that assignment with a good reputation, having fulfilled your contract thoroughly, and left there leaving people with the impression that they would have you back, the doors are going to fly open for you. And at that point, I really don't care what your level of experience is prior to that. You have established and taken the first major step towards becoming a professional locums. Now, locums, in my opinion, is a specialty in and of itself. And when I say that, I mean, as a locums provider, you are specializing in generals. In other words, when I walk into a place, I have got to feel confident in my abilities to handle whatever situation pops up. I can't walk into a place and start making demands and telling people what I'm not going to do either. I've got to be open to the opportunities that are ahead of me. If they ask me to work extra, be available to do that. If they ask me to do something a little different than I originally agreed to, be able to do that. If they need you for this, do this. When you get that kind of reputation as a person who is flexible and will go anywhere, another thing too is when you're starting as a locums provider, if you really want to work, you need to be prepared to pretty much go anywhere on your first gig. And the longer you go, then the more choicey, as we say down south, you can become. You can become choicey after you establish a reputation. Then you can start kind of culling jobs and start saying what you may or may not do. Now, I'll tell you, most of the recruiters that I work with know that it's really not about location for me. It's about money. I'll go work anywhere. I've gone to Indian reservations, right outside Indian reservations, where your population was mostly bleed over off the Indian health system, to some of the most far-reaching clinics you've ever seen in your life, to some of the smallest ERs out in the middle of nowhere in the dead of winter. But because I've established that reputation with my recruiters, I can also command high hourly rates or shift rates. Lately, I've been commanding shift rates. This is what I'll do that shift for. So you get that reputation of being able to go anywhere, fly out, do a 10-day rotation anywhere in the United States. Then you start being able to pick and choose and tell people what you are and aren't going to do. But see, I'm not the kind of person that tells folks what I'm not going to do. I tell folks, hey, this is what I'll come out there for. This is the amount of money I'll come out there for, and then I'll do whatever it takes. That's the way I look at it. You're paying me enough money. You're paying me $1,800, $2,000 a day to come out and staff your emergency room. I'm not making demands. I'm coming out there and I'm going to take care of whatever walks through that door or whatever rolls through on an ambulance. You're paying me $2,000 a day to take call in an emergency room, which is $1,700 to $2,000 a day to take call in the emergency room, is kind of my standard rate. So if I work 7 days, which is a pretty standard contract in the emergency room in these critical access hospitals, I'm making $14,000 for 7 days work, and I'm sleeping most of the night. So, but I don't make demands. Once they meet my salary requirements, I roll into that place with my sleeves rolled up and my work face on, because I'm there to work. I'm there to make money. So when I'm done, I want them to be left with the impression, hey, this guy can do it. So flexibility, ability to go anywhere, do anything, those are important things, especially right out of the gate. You new providers, if you're choicey and you're trying to pick and choose, and you're trying to nail down the perfect job straight out of locums, yeah, it's just not going to happen. And you got to get in your mindset that you're going to be flexible and you're going to be willing to go. So one last thing I'll say about this is this. There is a little cost sometimes associated with locums. Sometimes your companies will not pay for your initial licensing. But usually I say, after you've proven yourself, most locum companies will reimburse you for your licensing after you've paid for it. And then if they have assignments that they want you to go to, if you've proven yourself a valuable commodity to them, then they'll offer to pay for your licenses for those states. And I pretty well expect that at this point. If I'm going to make you a ton of money, which I am making them a ton of money, then I expect them to pick up the licensing as well. Honestly, I have never paid for my initial licensing in any of the states that I've worked in. Now, I have paid for renewal of licenses just to hold on to them. So, yeah, be ready to pay for your license up front, but negotiate with these companies. Say, if I pay for my license up front, after I work for you a month, I want to be reimbursed. And most of them will say, okay, well, that's reasonable. And then after that, they'll start paying for your licenses. So the word for the day is, first of all, be patient. Number 2, get your paperwork in, all of it, pound it out, whatever it takes. You're going to find it really doesn't take all that length amount of time to do it, but you got to get it in. Number 3, be flexible. Be flexible. You know, coming out, going straight into locums, you're not going to get the job you want right out of the gate. It's just not going to happen. You're going to have to take what you can get to get your foot in the door, knowing that after you get that experience and after you get that reputation, things are going to start falling into place for you. Be flexible. Be on top of your paperwork. Don't make demands. Look, if you want to do this and you want to be a professional locums, I consider myself at this point, after a year of doing this, a professional locum tenens healthcare provider. It's a specialty to me. This is what I do. If this is the kind of life you want, which I love it, I won't ever go back to a regular job. You got to do it. You got to pay your dues. You got to do what you got to do to get your life where you want it to be. Anyway, just the word for the day. If you have any questions, let me know. I'll be happy to answer them. This is Mark Hill, the Traveling NP. Until I talk to you next time, have a great day.